500,000 children lose their lives to diarrhea globally, a tragedy that's largely preventable with a low-cost and widely available treatment known as oral rehydration salts, or ORS. Our paper in Science looks at this vexing issue of the low rates of prescription of ORS for childhood diarrhea in India. Low prescription of ORS has been attributed to several factors. The first one is stockouts. ORS is less profitable than antibiotics. The second one looks at doctors receiving higher financial incentives prescribing antibiotics even when the underlying factor is viral. The third one is doctors assume that patients do not want ORS. To test which one of these are most relevant, we recruited over 2,000 providers in India and trained actors to pose as parents seeking treatment for their child's diarrhea. These actors randomly expressed a preference for ORS or antibiotics or no preference whatsoever. Some indicated purchasing medicine elsewhere to control for financial incentives. Half the participating towns in which the providers came from received a guaranteed ORS supply to test for stockout effects. Surprisingly, provider perception of patient preferences for antibiotics was the biggest culprit, contributing to 42% of underprescription. Stockouts and financial incentives played a minor role at 6% and 5% respectively. When patients expressed a preference for ORS, prescription rates soared by 27 percentage points. This impact was significantly greater than eliminating stockouts or removing financial incentives. Clear communication between the patient and doctor is key to boosting ORS use and saving lives. When patients actively share their preference for ORS, its use increases significantly. The results can be used to inform interventions that address provider misperceptions and empower patients to express their preferences clearly. We hope to use the findings of this study to design a number of future interventions that strengthen the doctor's ability to understand patient preferences and the patient's ability to cleanly express what they would like in the context of a doctor consultation. We believe this may be the start of an important way of treating and improving the quality of care in the context of diarrhea treatment and more generally in the context of over and under prescription of inappropriate care. Thanks.